Genius Solutions, Physician Quality Reporting System, or PQRS, and Clinical Quality Measures, or CQMs, 2016 edition. Overview. We will be covering the following topics in this webinar: basics of PQRS and CQMs, PQRS versus CQMs, reporting methods, CQMs certified through ehrTHOMAS, configuring a measure through ehrTHOMAS, PQRS and CQM measure descriptions, how to accumulate data for measures within ehrTHOMAS, and helpful links and resources. Basics of Physician Quality Reporting System, or PQRS, and Clinical Quality Measures, CQMs. Physician Quality Reporting System and Meaningful Use Clinical Quality Measures are two different CMS reporting programs. PQRS is a quality reporting program that encourages individual EPs and group practices to report information on the quality of care to Medicare. CQMs are tools that help measure and track the quality of healthcare services that works in conjunction with meaningful use. PQRS and CQMs have two separate payment adjustments for those who do not participate nor meet the requirements for the programs. Not all PQRS measures may qualify to meet the meaningful use CQM requirement. However, all CQMs will qualify to meet PQRS measures. Please keep in mind that there are hundreds of PQRS measures that can be reported in a different manner. However, there are only 64 CQMs out of those hundreds that will qualify for Meaningful Use Incentive Program. PQRS versus CQMs. PQRS, 12-month reporting period required. Performance rates cannot be 0%. Measures must relate to the EP's scope of practice. You must report at least 9 measures across 3 domains. At least one measure must be considered cross-cutting, which is defined as a measure that can be utilized through multiple specialties. CQMs, 12-month reporting period required. Performance rates can be 0%. Measures must relate to the EP's scope of practice. Must report at least 9 measures across 3 domains. PQRS reporting options are as follows. You must select only one. 1. Through Medicare Part B claims. 2. Through Qualified PQRS Registry. 3. Through Direct Electronic Health Records. 4. Through Certified EHR Technology via Data Submission Vendor. Or 5. Through Qualified Clinical Data Registry. Please note, if an EP satisfactorily reports for 2015 PQRS using the electronic reporting option, which is options 3 and 4, you will also satisfy the CQM component of the EHR incentive program. For CQMs, reporting options for EHR incentive program only, you must attest through the EHR registration and attestation system, or through eReport CQMs through the PQRS portal. Reporting options for other quality programs: 1. eReport CQMs through the PQRS portal. 2. Report group CQMs through Pioneer ACO participation or Comprehensive Primary Care Initiative participation. Please keep in mind that you must report all measures within one reporting method only. Genius Solutions will only report or support reporting via direct electronic health records. If you will be using alternate reporting methods, please refer to cms.gov for more information. Reporting PQRS and CQM measures utilizing the ehrTHOMAS. For PQRS and CQMs, 1. Select 9 measures across 3 domains pertaining to the scope of practice. 2. Configure measures appropriately within ehrTHOMAS. 3. Collect data pertaining to the selected measures. For PQRS, 1. Run your report frequently to ensure performance rates are not 0%. 2. Register for an EIDM account at www.qualitynet.org/PQRS in order to submit your PQRS information. 3. Submit your files at the end of the reporting period. For CQMs, register for EHR attestation website at www.ehrincentives.cms.gov, and 2. Submit your data through the EHR attestation website at the end of your reporting period. Please review this list of certified measures and select 9 measures across 3 domains that relate to your scope of practice. If you will not be utilizing ehrTHOMAS for your PQRS measures, or you cannot select 9 measures appropriate to your practice, please refer to the previous slides for alternative reporting options and methods. Configuring and meeting measures within ehrTHOMAS. Each selected measure must be configured in order to obtain appropriate data. Every measure configuration will be similar to one another, with the exception of the type of data that is being collected. When configuring measures, keep in mind that there are certain codes and information that correspond to each measure. We will now demonstrate how to configure a measure and go over how to accumulate data for each measure.
To review the list of CQMs that ehrTHOMAS is certified for, click on Reports, then click on System Measures. From this screen, click on Clinical Quality Measures, and you can review all of the CQMs here. Each CQM that is used must be configured to your EHR. We will use hypertension blood pressure management as an example. Select the appropriate CQM, then click on Configure. You will notice that this CQM requires a hypertension diagnosis code. To add the code, click on the Add button, and we'll search for hypertension at the bottom of the screen. Select the appropriate code, click on Select, and then to close out of the window, click Close. You will notice that the diagnosis code has now been added to this list. Since we have more hypertension codes, we will add the rest of them to the list. We'll click on Add, search for hypertension again, and then for each one we will click on the code and then select. To close out of the window, click on Close. You will notice that all of the hypertension diagnosis code has been added to the list. We'll click on Save to save that configuration. This process must be done for each CQM you want to report during attestation.
Preventive care and screening, body mass index screening and follow-up plan. Measure number is also referred to CMS 69, NQF 0421, or PQRS 128. Description of the measure is percentage of patients ages 18 years and older with a BMI documented during the current encounter or during the previous 6 months, and with a BMI outside of the normal parameters. A follow-up plan is documented during the encounter or during the previous 6 months of the current encounter. The domain is community or population health, and the measure is calculated by those patients who a follow-up plan is given to for those 65 years and older with a BMI outside of 23 to 30 or ages 18 to 64 with a BMI outside of 18.5 to 25 who have had an encounter in the previous 6 months.
To document the patient's BMI, click on Vitals. You must enter the patient's height and weight. Click on Height to enter the patient's height. To enter the patient's weight, click on Weight. The system will automatically calculate the BMI. Click on Save. If a patient has a BMI that falls outside of their normal BMI range, you should provide your patient with a follow-up plan based on their BMI. Inside the patient module, click on Follow-ups and select the appropriate code that you've configured for this measure, and then click on Next. Click on Complete and then Save.
Childhood immunization status. Measure number CMS 117, NQF 0038, and PQRS 240. Measure description, percentage of children 2 years of age who have had 4 DTaP, 3 IPV, 1 MMR, 3 Hibs, 3 Hep B, 1 VZV, 4 PCV, 1 Hep A, 2 or 3 RV, and 2 flu vaccines by their second birthday. The domain is community and population health. The measure is calculated by having all indicated vaccinations before the child's second birthday.
There are 2 ways to enter in immunizations for a patient: entering given immunizations or utilizing quick history. Click on Immunizations. To enter in a given immunization, select the appropriate immunization from the upcoming vaccinations list, or click on Add, click on the appropriate immunization, and then click on Select. Click Given, and fill out the appropriate information required for your immunization, and then click on Save. To utilize Quick History, click the Quick History button. Click on Give, and select what type of vaccination was given, and then fill out the immunization information. Then click on Save.
Diabetes, hemoglobin A1C poor control. Measure number referred to as CMS 122, NQF 0059, and PQRS 001. Measure description is percentage of patients 18 to 75 years of age with diabetes who had a hemoglobin of A1C greater than 9% during the measurement period. The domain is clinical process and effectiveness. The measure is calculated for those patients between the ages of 18 to 75 years who have had an active diagnosis of diabetes and have an A1C level greater than 9% recorded as a lab result.
Before you can add A1C data in for your patient, you must have an A1C test and test result. Confirm that you have an A1C test by going into Code Files, and then select Lab Test. Search for A1C. If an A1C test does not exist for you, click on Add. Type in a code and description, then click on Save. Close out of this window. Confirm that you have a test result by clicking on Lab Test Results. Search for A1C levels, and if the results do not exist, click on Add. Type in a code, a description, and change the data type to percentages. Then click on Attach to tab, and then click on Add. Attach the newly created A1C test by clicking on the lab test and then clicking on Select. Then click on Save. To add an A1C result to a patient's chart, click on Labs, and then click on Add. Select the A1C lab test, and then click on Next. Once your lab has been ordered, select the lab and then click on Edit. Type in the patient's A1C level and change the order status to Signed. Click on Save, and then have the provider sign off on the lab. Then click on Save.
Breast cancer screening. Measure number CMS 125, NQF 0031, and PQRS 112. Measure description is percentage of women ages 50 through 74 who had a mammogram to screen for breast cancer within 27 months. The domain is clinical process and effectiveness. The measure is calculated by women between the ages of 50 to 74 who have had a mammogram procedure performed in the office.
To indicate that this patient had a mammogram performed, click on Procedures. Search for the appropriate mammogram code that you have configured for this measure, and then click on Next. From here, click on Perform. Ensure that the procedure note is appropriate, and then click on Save. Then click on Save again.
Pneumonia vaccination status for older adults. Measure number CMS 127, NQF0043, and PQRS 111. Measure description is percentage of patients 65 years of age and older who have ever received a pneumococcal vaccine. The domain is clinical process and effectiveness. The measure is calculated by patients over the age of 65 who were administered a pneumococcal vaccination in the office or by an outside provider.
Before you can add an pneumonia vaccination status for a patient, you must have a pneumonia vaccination in your system. Confirm that you have an pneumonia vaccination by going into Code Files, and then select Immunizations. If a pneumonia vaccination does not exist, click on Add. Type in a description, and then click on the vaccination magnifying glass. If a pneumonia vaccination does not exist in this list, click on Add. Type in a description, and then click on Save. Select the newly created pneumonia vaccine, and then click on Select. Then click on Save. There are two ways to enter a pneumonia vaccine for a patient: entering the given immunization or utilizing quick history. Click on Immunizations. To enter in the given immunization, select the pneumonia vaccination from the upcoming vaccinations list or click on Add. Select the pneumonia immunization and then click on Select. Click Given and fill out the appropriate information required for your immunization, and then click on Save. To utilize Quick History, click the Quick History button. Click on Give, and in the drop-down, select Ammonia. Then fill out the immunization information, and then click on Save.
Colorectal cancer screening. Measure number CMS 130, NQF0034, and PQRS 113. Measure description is percentage of patients 50 through 75 years of age who had appropriate screening for colorectal cancer. The domain is clinical process and effectiveness. The measure is calculated by patients between the ages of 50 through 74 who have had a colonoscopy, flexible sigmoidoscopy procedure, or a fecal occult blood test performed in the office.
There are two ways to indicate that this patient was screened for colorectal cancer: performing a colonoscopy or a flexible sigmoidoscopy, or obtain lab results from a fecal occult blood test. To indicate that this patient had a colonoscopy or a flexible sigmoidoscopy, click on Procedures. Search for the appropriate code for this particular measure, and then click on Next. Click on Perform and ensure that the procedure note is appropriate. Then click on Save. Click on Save again. To add a fecal occult blood test result to a patient's chart, click on Labs. Then click on Add. Select the fecal occult blood test, and then click on Next. Once your lab has been ordered, select the lab, and then click on Edit. Type in the patient's result in the box, and then change the ordered status to Signed. Then click on Save. Have the provider sign off on the lab, and then click on Save again.
Preventive care and screening. Tobacco use. Screening and cessation intervention. Measure number CMS 138, NQF0028, and PQRS 226. The measure description is percentage of patients ages 18 years and older who were screened for tobacco use one or more times within 24 months, and those who have received cessation counseling intervention if identified as a tobacco user. The domain is population and public health. The measure is calculated by patients over the age of 18, must have a recorded smoking status, and patients who are currently using tobacco are given cessation counseling and/or medication for cessation.
There are two ways to indicate the patient's smoking status: through the Family Social History module or through the Family Health History module. Depending if you have the Structured Family History System setting turned on or off, your system may show a Family Social History button or a Family Health History button. If you see the Family Health History window, change the smoking status here appropriately. Then click on Review. If you see the Family Social History window, locate the Patient Smoking Status question and enter the appropriate smoking status here. Then click on Review. There are three ways to indicate that the patient has received smoking cessation intervention: by prescribing a tobacco cessation medication, adding the medication to their current medication list, or by giving the patient tobacco cessation counseling. To prescribe a tobacco cessation medication or to add a tobacco cessation medication to their list, click on Medications. Then click Doctor First. To prescribe a medication from the Doctor First website, click on Prescribe. Type in the medication you would like to prescribe, and then click on Find. Select a medication from the list. Do not free text the medication. Fill out the appropriate medication information, and then click on Continue. Verify that the medication information is correct, and then click on OK. To send out the medication that we just prescribed, type in the signature password and then click on Send. To add a medication to the patient's current medication list, ensure that you select Manage Meds. Type in the medication and then click on Find. Select the appropriate medication from the list. Do not free text the medication. Fill out the appropriate medication information and then click on Continue. To indicate that this patient had a tobacco cessation counseling performed, click on Procedures. Search for the appropriate cessation counseling code that you have configured for this measure, and then click on Next. Then click on Performed. Ensure that the procedure note is appropriate and click on Save. Then click on Save again.
Screening for future fall risk. Measure numbers CMS 139, NQF 0101, PQRS 318. Measure description is percentage of patients 65 years of age and older who were screened for future fall risk at least once during the measurement period. The domain is patient safety. The measure is calculated by patients over the age of 65 who were examined for future fall risk.
To indicate that you've performed a fall risk assessment on this patient, click on Examinations. Click on the examination that you have configured for this measure and fill out the findings appropriately. Once completed, click Save, and then save again.
Preventive care and screening. Influenza immunization. Measure number is CMS 147, NQF 0041, and PQRS 110. Measure description is percentage of patients ages 6 months and older seen for a visit between October 1st and March 31st who received an influenza immunization or who reported previous receipt of an influenza immunization. The domain is population and public health. Measure is calculated by patients over the age of 6 months who were administered an influenza vaccine in the office or by an outside provider.
Before you can add a flu vaccination status for a patient, you must have a flu vaccination in your system. Confirm that you have a flu immunization by going into Code Files and select Immunizations. If a flu immunization does not exist, click on Add. Type it in description, and then click on the vaccination magnifying glass. If a flu vaccination does not exist in this list, click on Add. Type in description, and then click on Save. Select the newly created immunization, and then click on Select. Now click on Save. There are two ways to enter an influenza vaccine for a patient: entering the given immunization or utilizing quick history. Click on Immunizations. To enter in the given immunization, click the influenza immunization from the upcoming vaccinations list or click on Add. Select the appropriate immunization and then click on Select. Check Given and fill out the appropriate information required for your immunization. Then click on Save. To utilize Quick History, click the Quick History button. Click on Give and indicate that an influenza vaccination was given. Then fill out the immunization information. Then click on Save.
Weight assessment counseling for nutrition and physical activity for children and adolescents. Measure number CMS 155, NQF 0024, and PQRS 001. Measure description is percentage of patients 3 to 17 years of age who had an outpatient visit with a PCP or OB-GYN and who had evidence of 3 reported rates during the measurement period. The domain is population and public health. There are 3 rates that are reported to calculate this measure: percentage of patients with height, weight, and body mass index percentile documentation, percentage of patients with counseling for nutrition, and percentage of patients with counseling for physical activity.
To document the patient's BMI, click on Vitals. You must enter the patient's height and weight. Click on Height to enter the patient's height. To enter the patient's weight, click on Weight. The system will automatically calculate the BMI. Click on Save. If a patient has a BMI that falls outside of their normal BMI range, you should perform nutrition or physical activity counseling. To indicate that you have performed counseling, click on Procedures. Search for the appropriate nutrition or physical activity procedure that you have configured for this measure, and then click on Next. Then click on Performed. Ensure that the procedure note is appropriate, and then click on Save. Then click on Save again.
Use of high-risk medications in the elderly. Measure number CMS 156, NQF 0022, PQRS 238. Measure description is percentage of patients 66 years of age and older who were ordered high-risk medications. Domain is patient safety. There are 2 rates that are reported in calculating this measure. A, percentage of patients who were ordered at least 1 high-risk medication. Percentage of patients who were ordered at least 2 different high-risk medications.
For this measurement, the system will automatically calculate if the patient was prescribed a high-risk medication or is currently taking a high-risk medication based upon the configuration. Note that this person has a high-risk medication in their current medication tab. If we go to the CQM report for high-risk medication, you will be able to see them in the numerator for that report.
Diabetes, low-density lipoprotein or LDL management. Measure number is CMS 163, NQF 0064, and PQRS 002. Measure description is percentage of patients 18 to 75 years of age with diabetes whose LDL was adequately controlled, which is less than 100 milligrams per deciliter, during the measurement period. Domain is clinical process and effectiveness. The measure is calculated by those patients between the ages of 18 to 75 with an active diagnosis of diabetes with LDL levels less than 100 milligrams per deciliter reported as a lab test result.
For this measure, the patient must have a diagnosis of diabetes. To add a diabetes condition, click on Condition Tracking. From here, search for your appropriate diabetes code. You may select this condition as a contributing condition. Then click on Next. Then click on Cancel. To add lipid test results to a patient's chart, click on Labs. Then click on Add. Select the appropriate lipid test and then click on Next. Once your lab has been ordered, select the lab and then click on Edit. Type in the patient's results in the box. Change the order status to Signed and then click on Save. Have the provider sign off on the lab and then click on Save again.
Controlling high blood pressure. Measure number CMS 165, NQF 0018, and PQRS 236. Measure description is percentage of patients 18 to 85 years of age who had a diagnosis of hypertension and whose blood pressure was adequately controlled, which is less than 140/90 during the measurement period. The domain is clinical process and effectiveness. The measure is calculated by those patients between the ages of 18 to 85 with an active diagnosis of hypertension and blood pressure less than 140/90 recorded as a vital.
For this measure, the patient must have a diagnosis of hypertension. To add a hypertension condition, click on Condition Tracking. Then click on Add. Search for your appropriate hypertension code, and then click on Next. You may select this condition as a contributing condition. Then click on Cancel. To record the patient's blood pressure, click on Vitals. Enter the systolic measurement, and then the diastolic measurement. Then click on Save.
Ischemic vascular disease, complete lipid panel and LDL control. Measure number CMS 182, NQF 0075, and PQRS 241. Measure description is percentage of patients 18 years of age and older who were discharged alive for acute myocardial infarction, coronary artery bypass graft, or percutaneous coronary interventions in the 12 months prior to the measurement period, or who had an active diagnosis of ischemic vascular disease during the measurement period, and who had each of the following during the measurement period: a complete lipid profile, and LDL-C was adequately controlled. The domain is clinical process and effectiveness. The measure is calculated by patients older than 18 years of age with one of the following: active condition of ischemic vascular disease, percutaneous coronary intervention was performed, and coronary artery bypass graft performed, and test results for a complete lipid profile were added.
For this measure, the patient must have a diagnosis of hypertension. To add a hypertension condition, click on Condition Tracking. Then click on Add. Search for your appropriate hypertension code, and then click on Next. You may select this condition as a contributing condition. Then click on Cancel. To add lipid test results to a patient's chart, click on Labs. Then click on Add. Select the appropriate lipid test and then click on Next. Once your lab has been ordered, select the lab and then click on Edit. Type in the patient's results in the box. Change the order status to Signed and then click on Save. Have the provider sign off on the lab, and then click on Save again.
Helpful resources. Genius Solutions is integrated with the following third-party PQRS registries: Wellcentive and Crimson Care. If you are interested in joining one of the indicated registries, Genius Solutions recommends contacting the registry to inquire whether or not your office is eligible for integration. Please refer to the following websites for more information regarding PQRS and CQMs as well: www.cms.gov and www.qualitynet.org/PQRS. Thank you for watching our PQRS and CQM webinar. For additional support, please call 586-751-9080 and option 7 for EHR department. We are open Monday through Friday, 8 a.m. to 6 p.m. Eastern Time. Thank you and have a great day.